This video is about OET speaking. In OET speaking, the examiner often knows your score before the role play even reaches the treatment plan. Not because of your grammar, not because of your accent, but because of how safe your patient feels in the first 90 seconds. So, today I'm going to show you a completely different way to approach OET speaking, a method I call the trust loop. Once you understand this loop, you will never panic in a role play again. So, this video is not about memorizing phrases, it's about controlling the emotional play of the role play. Okay, so if you can do that, you automatically score higher in relationship building, understanding and clarifying, and of course, in clinical communication. So let me say this very clearly. OET speaking is not a conversation, it's not acting, and it's definitely not counseling. It's a controlled professional interaction. Remember this. Examiners are watching for one thing. Does this healthcare professional create safety, clarity, and direction? That's where the trust loop comes in. Now, the trust loop has four repeating moves, not steps. You don't do them once, you cycle through them naturally. The four moves are the first one, acknowledge reality, anchor the patient, guide the focus, and close the loop. So these are the four moves. This is not the same as empathy, questions, or explanation. No, this is control without sounding controlling. Now, let me take you through the four moves one by one. The first move is acknowledging the reality. What most candidates do here is they jump into empathy lines. I understand how you feel. Sounds nice, but often sounds rehearsed. What high scorers do is they acknowledge the situation, not just emotions. For example, they use the phrases like, given how uncomfortable breathing problems can be, it makes sense that this is worrying you. In this situation, or they will start with the phrases like, with everything that's been happening, got it? If a patient is having a breathing issue, so patient says like, I feel like I can't breathe properly. Then you should say like, given how uncomfortable breathing problems can be, it makes sense that is worrying you. If you notice here, it is not so dramatic empathy, right? And it shows the calm realism and also the professional tone. So examiners hears this one as safe, grounded clinician. Got it? And the next one is anchor the patient. So, this is the second move. This is where your approach becomes different from 90% of candidates. So, when we say anchoring, that means telling the patient what will happen next immediately. Patients often panics when they don't know the structure, right? So, you can use some of the anchoring phrases. For example, let me explain what we will do first. Before we go further, I will quickly outline your plan. We will take this step by step. Got it? So, an example scenario like chest pain scenario. Okay. First, I'll ask you a few questions to understand the pain better. Then, I'll explain what might be causing it and we can do next. So, this one reduces the anxiety and this one shows leadership. This one boosts the relationship building instantly. Got it? So this one we called as an anchoring move. The third move is guide the focus. So this replaces random questioning. You're not asking, you are directing the attention. Instead of saying like, can you tell me more? You can say like, let's focus on when the pain started. Instead of saying, is it severe? You can ask, like, on a scale of 1 to 10, where would you place it? Got it? So, here is an example of a diabetic patient. So, you can say, like, to understand this properly, let's focus on your blood sugar levels over the past week. So, here the examiner hears the clarity, structure, And it's, of course, purpose driven communication. Got it? Now, the fourth move here is close the loop. Yes. Most candidates forget this. Closing the loop means checking understanding and emotional responses together. Strong closing lines such as, how does that sound so far? Does this approach feel manageable for you? What concerns do you still have at this point? So let me show with an example. Medication explanation. Say, for example, you can use the sentence like, so we will adjust the dose slightly and monitor your response. How comfortable do you feel with this plan? So this hits understanding and clarifying, relationship building, and professionalism. Got it? Now let's move on to an example here. So this one is the OET speaking task card. You're a nurse working in a community health clinic. Patient name is Mr. David Warner, 52 years old. And the scenario is Mr. Warner has recently been checking his blood pressure at home and noticed that his readings are higher than usual. He is anxious and concerned about what these changes could mean for his health. And your task, you are required to acknowledge the patient concern about his high blood pressure readings, explain what the readings indicate in simple, understandable language, ask relevant questions about his lifestyle and habits that could affect blood pressure, advise on next steps for managing blood pressure, including monitoring lifestyle adjustments and medication if appropriate, and check the patient's understanding and address any concerns before closing the consultation. Got it? Now, everything is clear. What you're supposed to do, what is required in your speaking, everything is given here. Try to incorporate the moves that we have discussed so far and come up with your reading response. Now, let me give my reading response. Okay? Given how worried you are about your blood pressure readings, it's completely understandable that this situation feels stressful for you. When numbers change unexpectedly, it can make anyone feel uncertain. Let me briefly explain how we will handle this today so you know what to expect. First, I'll ask a few questions about your recent readings and daily routine. Then I'll explain what these results actually mean. And finally, we'll talk about the next steps to manage this safely. To start with, let's focus on when you first noticed the increase in your blood pressure. Was it something that happened suddenly, or has it been gradually rising over the past few weeks? And have there been any changes in your lifestyle recently, such as diet, sleep, or stress levels? Based on what you have described, these readings suggest that your blood pressure is higher than ideal. But the good news is that this is something we can control. Think of blood pressure like pressure in a water pipe. When it stays high for too long, it puts strain on your system. But with the right adjustments, we can reduce that pressure and protect your body. What we will do now is review your medication, discuss some manageable lifestyle changes, and monitor your readings regularly to see how your body responds. You're not expected to fix everything at once. We will take this step by step. So, just to recap, we will start by adjusting your management plan, keep a close eye on your readings, and review your progress soon. How does this plan sound to you so far? Do you have any concerns or questions you would like to address before we move forward? Now, when I say this response, remember I have incorporated all the moves. The first one is acknowledging the reality. Given how you worried you're about your blood pressure readings, it's completely understandable that this situation feels stressful for you. So this one acknowledges the situation, not just emotion, right? Sound professional, not rehearsed. And the second move, anchor the patient. So, where it happens, let me briefly explain how we can handle this today. So, and so, and then first, then finally. So, it gives the structure, reduces the patient anxiety, it shows the leadership and control. Got it? Then, the third move, let's focus on when you first noticed so and so. Have there been any changes in your lifestyle? All these things, right? So here, these things are purpose-driven questions, not random or interrogative. So this one is excellent for understanding and clarifying. And the fourth move here is, yes, just to recap, we will start so and so, and then we have also included how does this plan sound to you so far. So here, this section confirms understanding and also checks emotional readiness, ends the interaction in a professional way, right? So examiners hears this as confidence and clarity. That's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye bye.